of our Ask a Doctor series. I'm Titania Bailey, president of Arc of Knowledge, Inc. And for those of you who are unfamiliar with our organization, Arc of Knowledge, or AOK as we like to call it, is a nonprofit organization that strives to bridge the gap between our youth and seniors in an effort to create bonds that transcend differences in age and ability, and ultimately create supportive and engaging environments that are equitable for all generations throughout their lifespan. One of our initiatives is generational health and well-being. As part of this initiative, we have the pleasure of partnering with MedStar Health and their team of specialists to provide education and resources that promote better health practices. As you know, February is American Heart Month, and today's seminar is focused on heart health. So before we get into our introductions, I'd like to just give a couple housekeeping tips. If you could stay muted throughout the presentation, that would be great. But I would like to encourage everyone to put all of your questions in the chat. And once the presentation is done, we will present these questions to be answered accordingly. With that said, joining us today is Dr. Brian Case. Dr. Case, a Montgomery County native, graduated cum laude from St. George's University School of Medicine in 2012, and then participated in an internship at NYU Langone Hospital in Long Island. Dr. Case completed an extensive residency at MedStar Georgetown University and was selected to participate as the 2015-2016 Chief Medical Resident for Internal Medicine. He then obtained fellowship training through a joint program at both MedStar Georgetown and MedStar Washington Hospital Center in Washington, D.C., followed by 2 years of combined research and clinical intervention cardiology. Dr. Case joined the cardiology team at MedStar Southern Maryland Hospital Center in August 2021 as an interventional cardiologist and a member of the MedStar Heart and Vascular Institute. He is board certified in interventional cardiology, cardiovascular disease, and internal medicine with extensive fellowship training. Dr. Case specializes in treating patients with coronary artery disease through modern technology interventions, such as optical coherence tomography, which produces high-definition images of the artery to help guide stent selection, placement, and deployment. His fellowship training includes performing fractional flow reserves, instantaneous wave-free ratios, and evaluating for physiological cardiac ischemia.
Ischemia, yeah.
Please welcome Dr. Brian Case.
Yes, thank you so much. That might be the best introduction I've ever had. So first of all, thank you so much for the opportunity to present today, and I'm very excited to talk about heart health, especially the month of February, as is Heart Health Month. If I could just share my screen, I can pull up some slides. I'll be relatively brief with my presentation and the slides portion of the hour, but really my hope is to use this opportunity to really answer any questions you guys may have to help clarify things further. I think I need to be enabled. Oh, there, perfect. Can you guys see my screen? Okay, perfect. So once again, thank you for this opportunity. So four kind of topics to discuss. First, I want to just briefly talk about what are the signs and symptoms of cardiovascular disease, specifically signs and symptoms of a heart attack, and then signs and symptoms of a stroke. It's important for everyone to know what those symptoms are, identify them early, and if you are having those symptoms, seek medical care quickly. Second, I want to talk about potential risk factors that can lead to heart attack and stroke, specifically those risk factors that are modifiable, meaning if you live a healthy lifestyle, a lot of these risk factors will improve and will decrease your risk of developing a heart attack and a stroke. Third, I want to talk about what actually is a heart healthy lifestyle and what goes into it. And then finally, at the end, we can have a Q&A session, which I feel like will be the most important part. So heart attack and stroke, these are the main players when it comes to cardiovascular disease. What exactly is a heart attack? So you can see here, this is a model of the heart, and you can see blood vessels. And then zoomed in, blood flow goes down the blood vessel and supplies blood to the heart to allow the heart to pump to supply blood to the rest of the body. If there is an occlusion here due to plaque buildup and the blood flow down the heart is impaired, that's a heart attack. It's a sudden decrease in the blood supply to the heart itself. It's very frequent. It happens 800,000 times a year. And if you think that's about every 40 seconds, there's a heart attack. What are the signs and symptoms of a heart attack? The most common ones are on the top, as you can see here: chest pain, shortness of breath, or discomfort or tingling in the arm, back, neck, or jaw. So typically patients will have chest pain or chest pressure that will move to the arm, the neck, or the jaw. These are all classic symptoms for a patient potentially having a heart attack. And if you're having these symptoms, you should be evaluated sooner than later. One thing to note is not every patient that's having a heart attack has the most classic common symptoms. If you see down here, especially in women, sometimes they present a little bit different. Sometimes they might just have heartburn. They might have been having heartburn for 24 hours. They took a couple of Tums, and despite taking the Tums, the heartburn was still there. That might be a heart attack. They might just feel fatigue or tired, dizzy, associated nausea, vomiting, or cold sweats. If you're having these symptoms and you can't really explain another reason why, this could potentially be a heart attack, and you should be evaluated sooner than later. So, again, if you have these symptoms, it's important to seek medical therapy sooner than later. In the cardiology field, we have a saying that is, time is muscle, meaning the more you wait to get evaluated for your heart attack, the more impact or damage it could have on your heart. And we actually saw this during the COVID-19 pandemic early on. Patients were having heart attacks, but they were afraid to come into the hospital because they were worried about getting COVID-19 in the ER or on the floor. So they were staying home with their heart attacks, and then they were getting permanent damage before we could fix them. And then they would come to the hospital later on with subsequent problems due to their untreated heart attack. So if you have the symptoms, come in early and soon so we can help you. Second thing is a stroke. So again, you have blood vessels that supply blood flow to the brain. If one of those areas of the blood vessel gets cut off, there's decreased blood to the brain, and that results in a stroke. And without blood or oxygen going to the brain, this could be serious. It can cause permanent damage, and it could also cause something very serious like death. Just like with a heart attack, it happens every 40 seconds in the United States. Think about it. For the time I've been talking, there has been a few heart attacks and strokes in the United States, and this can be preventable. What are the symptoms for a stroke? It usually happens quickly and suddenly, and you usually have to, again, act fast. The symptoms are vision changes. So you might have blurred vision in both eyes or one eye. You can potentially have trouble speaking. All of a sudden, you can't make out the same words you were able to before, or you can't speak at all. Third is you lose movement in the face or the limbs, meaning the arms or the legs. And it typically is one-sided. So all of a sudden, one side of your face might droop down, or you're unable to move your left or your right arm. That's worrisome. Some other causes that are not as specific could be, or symptoms could be having a headache, confusion, numbness, tingling, or loss of balance. If you have a sudden onset of any of these symptoms, once again, please call the 911, come to the emergency room soon, quickly. And once again, we can help you if you come early on with your symptoms. So those are the causes for both a heart attack and a stroke. Now I want to talk about the risk factors that lead to a patient having a heart attack and a stroke. And when we talk about risk factors, we talk about modifiable risk factors and non-modifiable risk factors. The non-modifiable risk factors are the ones we cannot control. This is your age, this is your race, these are the genetics that you're born with from your lovely parents. These are things you can't control. The modifiable risk factors, though, you can control. And it's important to identify these risk factors in order to treat them, in order to prevent having a heart attack or a stroke. So the first one, the big one, hypertension, also known as high blood pressure. So blood pressure is the force of your blood moving against the walls of your arteries. And it's expressed in two numbers, as you can see here, the systolic number and the diastolic number. Over time, if your blood pressure is elevated, it can cause damage to both your heart, your kidneys, your brain, and it can ultimately lead to both a stroke or a heart attack. Why is blood pressure important to screen for? For a lot of patients, they have high blood pressure and they don't know it. Again, we have a saying we call high blood pressure the silent killer, because patients could have a high blood pressure for years and years and years and not know it, and they're getting damage to their heart, the kidneys, and their brain. And again, this is 100% preventable. You just need to put a blood pressure cuff on at home or in the grocery store, at the pharmacy, or in your community. You just need to identify high blood pressure because, of course, there's medications where we can lower that blood pressure. What's normal? A normal blood pressure is 120/80. There's a lot of numbers here. So really just remember the top number should be 120. When are you at risk? You're at risk when you are getting above 130, as you can see here. And when do we treat? We typically treat when we get to 140 or above. So if you ever get a blood pressure reading at home in your community, and that top number is above 140 or that bottom number is below 90, there's a very good chance you might have high blood pressure. And this would be a reason to go see either your primary care doctor or a cardiologist, because we can help you to lower that blood pressure to get it closer to 120. So very, very easy thing for patients not to know they have, but very, very common and extremely treatable, and it can help prevent heart attacks and stroke. Second thing is cholesterol. What is cholesterol? It's a fat-like substance in your blood that, if you have too much of it, clogs the arteries and is the precursor that results in heart attack or stroke. If you remember what I said earlier on, decreased blood flow or occlusion of the blood vessel leads to both a heart attack or a stroke. And how does that occlusion happen? It's the buildup of this cholesterol in the blood vessel itself. So you imagine if you have very high cholesterol, you're at an increased risk of this blockage developing sooner or earlier in life, or to be more severe. So it's important to get physicals done and have blood tests done so we can check both your bad cholesterol, your good cholesterol, and then also your fatty acids to fully understand your makeup of your cholesterol panel. And once again, if there is an abnormality, we can treat it. The third risk factor that is sometimes undiagnosed but is treatable is diabetes, also known as high blood sugar. What is diabetes? It's a condition, a syndrome in your body where your body can't properly process sugar correctly, and it's due to insulin resistance. Thus, the sugar stays in your blood longer than it should, and it could damage multiple different organs, such as your heart, your kidneys, your eyes, your nerves, your the blood vessels in your feet, and can cause a lot of complications. Again, very common. More than 30 million adults in the US have diabetes, and that number is growing by the year. And then more concerning is about 1 in 4 adults with diabetes don't know they have it. So just like with hypertension, just like with high cholesterol, it is common, it goes undiagnosed, but it could be easily diagnosed. And if it is identified, it could be easily treated as well. What are the symptoms of diabetes? Because this is important, because if you're having these symptoms, you should be screened. If all of a sudden you have increased thirst and increased hunger, that could actually be a sign of diabetes. 2, if you are urinating more than you were in the last 6 months, that could be due to from diabetes. That's because the sugar is staying in your blood longer than it should be, and that results in increased frequent urination. Blurred vision is also another reason. So the sugar can get into the small blood vessels of your eyes, and that could damage those blood vessels, and that could cause you to have blurred vision. And then if you don't address that problem or treat your diabetes, that's also a precursor to developing glaucoma, which is very common later in people's lives. Also, lastly, another symptom is numbness in the hands and feet. If you have unexplained reasons, that could be diabetes as well. So you can see, not only does diabetes affect the heart, but it can affect the whole body. So just like hypertension and hyperlipidemia, it's important to identify and important to screen for it. So how do we live a healthy lifestyle? How do we prevent weight gain? How do we prevent the development of worsening diabetes, high cholesterol, or high blood pressure? So there's 7 steps to a healthier heart, as you can see here, and we'll go into detail each kind of step in this pyramid from top to bottom. The number one way to live a healthy lifestyle is stopping smoking. If you smoke cigarettes for whatever reason, it's the number one way to decrease the risk of developing a heart attack or a stroke. So smoking hurts every organ in your body. It hurts your brain, it hurts your kidneys, it hurts your heart, it hurts your lungs. Smoking causes 1 out of 4 deaths from heart and vascular disease. And then for the heart in general, it also worsens your risk of having hypertension. It can have you have a regular heartbeat. And it also promotes the buildup of that cholesterol plaque in your heart as well. It's easy for me to say, you should quit, but I know it's harder in actual reality. These are some tips on how you can quit. Find a plan that best fits you. Some people like to go cold turkey. Other people like to quit in a group setting, multiple friends or colleagues. Some people need to rely on both the patch or the gum, while other patients need actual therapy, like pharmacological therapy, which we can provide that helps people quit smoking, such as Chantix, which I'm sure you've seen on the on commercials before. Once you have a plan that fits you, set a date, remind yourself why you're quitting. You want to live longer, you have loved ones, you have children, you have grandchildren, you want to be around so you're not going to have a large heart attack or stroke. Avoid activities or places that make you want to smoke. So, easier said than done, but is there a trigger that makes you want to smoke, like a stressful situation at work, or a social setting where you're going to want to smoke? Try to avoid if you can. Make it public. Tell your loved ones or your friends that you were trying to quit, and they're going to be with you on the ride and giving you positive encouragement where it's appropriate, and ensuring you're living up to your part of the bargain and not smoking. And if you still are having issues, please come see us, your primary care doctor, a cardiologist, a pulmonologist. There are other, like I said, treatment options out there where we can help you quit smoking. If you quit smoking, your risk of having a heart attack or a stroke is 5 to 10-fold decreased. And I always hear the question, well, I've been smoking for 30 years, so the damage has been done. That's actually not true. Once you stop smoking, your risk goes down dramatically, even if you've been smoking for 30 years. So at any point in that timeline, you can change your trajectory of potentially having a heart attack or a stroke. The second thing is both physical activity in general, and then also physical activity to reduce stress. We know that physical activity leads to weight loss, and then also physical activity leads to stress reduction. What do I tell my patients? I say, goal should be 30 minutes of aerobic exercise at least 3 times a week. What's aerobic exercise? Really, it's patient dependent. Some patients' aerobic exercise is swimming, running, riding on a bike, while for other patients, it's walking around the neighborhood. The goal is really just to get the heart rate up, maybe a little bit of a sweat, and just feel like you're exerting yourself beyond what is your comfort level. If you do this, it results in a stronger heart, improved circulation throughout your body, lifts your mood and self-esteem, and promotes better sleep. Also, it leads to weight loss. It can lower your blood sugar, your blood pressure, and your cholesterol. It can potentially get you off medications for high blood pressure, high cholesterol, or diabetes. And it also reduces your stress overall. And these are just some recommendations of doing moderate exercise kind of outside the norm. Like I said, brisk walking around the neighborhood, in the mall, where, at work, during your break, or some patients will pick up dancing. And again, this doesn't have to be crazy dancing, but it could potentially be, square dancing, line dancing, gardening outside, doing lawn work is aerobic exercise, household chores such as vacuuming. If you're in a small building, walking up 2 flights of stairs instead of using the elevator, small things like that can go a long way in promoting an active lifestyle and a active heart health. The other part that goes hand in hand with exercise is diet. And I'm always asked, what's the heart health diet? So these are kind of the main food groups you want to think of when you're thinking of a heart health diet. It's going to be fruits, veggies, nuts, whole grains, vegetables, proteins, lean meats, or fish. And really, you can kind of break it down into 3 categories. They're a little bit different, but overall, they're pretty similar. I usually promote the Mediterranean diet, which you can see on the left. And if you think about it, it's not that bad. It's light on dairy, meats, and sweets. And by meats, I mean like red meat. But it's positive for fish, chicken, olive oil, vegetables. And it also shows that a little bit of wine in moderation, 1 glass here and there, is actually beneficial for the heart. And then on the other side here, the DASH diet, it's probably the diet that's been most studied in the cardiology field, but it's actually very similar to the Mediterranean diet. Again, it's going to be lean meat, chicken, fish, vegetables, avoiding heavy amounts of salt in your diet, which can lead to high blood pressure, in sweets as well. And then a lot of patients in the middle are adapting the vegetarian lifestyle. So just cutting out meats altogether and promoting vegetable proteins with soy products and legumes. And then some will take it even further and become vegan, and some will do only whole food, plant-based eating. In general, all three of these are pretty effective, healthy, and can promote a active lifestyle where you could potentially lose weight. As you can see down here, these are some other suggestions. Again, cut back on processed meats and saturated fats, avoid trans fats, drink water instead of sodas or juice. You'd be surprised how much sugar is in both sodas and juice, so try to drink water when you can. Also, the big thing, which is becoming more and more studied in the cardiovascular field, is portion control. In the United States, we do have a epidemic when it comes to portion control. Think about it. When you go out to eat and you get your entree, our plates are 20% larger than the plates that you would get, over in Europe. So just in general, us as a society in the United States are just eating more quantity of food than our counterparts in other regions within the world. So just cutting back on your portions can do a lot for weight loss as well. In addition, there is evidence that some of these fasting weight loss programs are beneficial. The evidence is light, but it is beneficial. But one thing we do know from the fasting diet is try to avoid having a large meal right before going to bed. When you go to bed, your metabolism slows down a lot. And if you have had a large meal right before going to bed, your body will process that food differently and will store it more as fat versus actively using it or storing it as muscle. So all little tips to think about with your diet. So again, these are the 7 steps to a healthier heart. Number 1, in my opinion, is if you're smoking, you got to stop smoking. There's just no excuse for it these days. It leads to cancer, heart disease, stroke, and it's just a poor, dental hygiene. Move your body, stay active. 30 minutes of aerobic exercise at least 3 times a week, and with that, a heart healthy diet, either a Mediterranean diet, a DASH diet, a vegetarian, vegan diet with good portion control, staying active while you're doing it. If you do those 2 things, that was certainly going to lead to weight loss. And then also on top of that, make sure you are at least screening once a year. I would say more, but at least once a year for high blood pressure, hypertension, diabetes, high blood sugar, and hyperlipidemia or high cholesterol. This could be easily done by a routine physical with your primary care doctor, or at the bare minimum, check your blood pressure when you're out in the community. And if that top number is higher than 140, please seek medical care. And then lastly, if you are having signs or symptoms of either chest pain, a heart attack or a stroke, please come see us in the hospital sooner than later, because we can help you, but we want to help you early on in the disease process versus later on. So I thank everyone for the time. And now, more importantly, I look forward to answering any questions that anyone may have. Should I stop sharing or? But do you want me to answer the questions or?
Okay, I'm sorry.
No, that's okay.
Allow me to unmute. I apologize.
Yeah.
We do have some questions in the chat that we can go over. And I have a few questions that were given to me prior to the meeting. So we can go to the chat first.
Okay.
First one is, how often should the cholesterol test be done, and at what age should you begin to get these tests?
Yeah, great question. So they actually recommend that you check your cholesterol at age 18. So it's not uncommon for kids in high school or going to college to get at least their first cholesterol checked as kind of a primary care annual physical. If it's normal, then it should be we say every 1 to 2 years. But the typical pattern by physicians will be that they will check every year with the physical. If you do have high cholesterol and you are trying to lower it by doing physical activities, healthier lifestyle, things of that nature, we try to monitor it every 6 months. And then if you're on therapies, if you start like a new therapy, then we will check it at 6 months after that. And then if you are chronically doing well on that therapy, we monitor every year in the future. So the range is typically every 6 months to a year after you've been diagnosed with either borderline or actual high cholesterol.
From Jamie, is there one healthy superfood we should be consuming for heart health?
Yeah, that's great. So, in my opinion, the superfoods is the Mediterranean foods, specifically like fish, olive oil. Those are probably the most two beneficial for the heart and for heart health. And then a little like kind of second tier would be fruits, vegetables, nuts, and grains.
We have another question. This is from a phone. I'm sorry. It says, can COVID vaccines contribute to heart problems?
Yes, of course. This is a very hot topic these days. So there's no evidence that the vaccines cause heart attacks or strokes. For certain patient population, specifically for whatever reason, young males, there is a small increased risk for myocarditis. What is myocarditis? It is a inflammation of the heart that is thought to be triggered by the vaccine. And it can be subtle, meaning, not really clinically meaningful, or patients could be symptomatic for it. That being said, that risk is very small, about 1%, 1 to 2%. But interestingly, having COVID-19, the infection, can cause myocarditis as well, and causes myocarditis at a much higher rate than what the vaccine causes. The rates for myocarditis by COVID-19 infection itself can be anywhere between 5 to 10%. So in the healthcare community, we feel like the risks of getting COVID-19 and then also COVID-19 myocarditis completely outweigh the risk that you may get from the COVID-19 vaccine. And that's the reason why, even though there's this uptick from a population standpoint, it's still important that everyone gets the COVID-19 vaccine. In addition, if you have all these risk factors we've talked about today, or God forbid you have heart disease or a stroke, if you get COVID-19, we know this by tons of data. If you get COVID-19, your risk of serious complication or even death is higher versus somebody who doesn't have risk factors or heart disease. So if you have high blood pressure, you have diabetes, you have high cholesterol, you've had a stroke before, you've had a heart attack before, you should be protected by COVID-19 with the first series of shots, and then also the boosters as well to protect you.
Okay, and then our next question is, okay, I'll go to Sylvia's question. Can you speak about when a woman enters menopause and how it may affect the heart?
Yeah, no, that's a great question. Um, when the hormones change during menopause, so let me step back a second. When women in general, they usually have a better cholesterol panel. The estrogen increases the good cholesterol and suppresses the bad cholesterol. So that's why overall women are slightly protected from heart attacks, or don't have heart attacks as much as men do, because of the estrogen results in a better cholesterol panel makeup for women. When they go into menopause, the estrogen decreases, and that can abnormally impact the cholesterol, and the good cholesterol can go down, the bad cholesterol can go up, and that can result in an increased risk for high cholesterol, which would subsequently lead to potential for a stroke or a heart attack. So that imbalance can occur. And then in addition is, again, elevated blood pressure can occur as well, hypertension, with women as they age, and then especially with menopause as well.
Thank you. The next question is, why are people of color at higher risk of heart disease?
Yes, that's an excellent question. Some of it has to do with just genetics. There is more prone to high blood pressure for sure, and this is evidence-based, and also more prone to high cholesterol and diabetes as well. And that just genetic component of it can occur even earlier in a patient's life. So, typically these risk factors may come in patients' 40s or 50s, but for whatever reason, for African Americans, it can come in the 20s and 30s. And then if you think about it, like I said before, a lot of patients don't know they have high blood pressure. They don't know how they have diabetes. They don't get the proper screening, and they're getting it earlier in life. So there's another 5 to 10 years of this disease process going undiagnosed, causing damage to the heart, the kidneys, the brain, the blood vessels, and then subsequently over time, the heart attack and the stroke happen.
What tests are best for detecting blockages in women?
Yeah, that's a great question. So our goal as cardiologists, first and foremost, is making the diagnosis of these risk factors and treating you for these risk factors to prevent anything happening. Once you've developed symptoms like chest pain or shortness of breath or fatigue, and you think you might have plaque buildup, that's when we start, doing testing to look to see if there truly is a blockage, and if we can maybe fix it and fix the blockage by putting a stent in or something like that. There's no one test that uniformly is perfect for every patient. We base it on a lot of factors, what the patient is feeling, their risk factors, their age, can they walk on a treadmill, things like that. Then the first line testing modality treatment option is doing a stress test, where you run on a treadmill. We have the EKG leads on you, and we're seeing if there's any evidence of a blockage. some patients will also get an echocardiogram, which is an ultrasound of the heart, where we look at the function and the structures of the heart to make sure there's no abnormality. A newer thing that's being done is coronary CTs. So you get a CAT scan of the chest, and we can look specifically at the blood vessels of the heart to see if there's any narrowing or blockage. If any of those tests are abnormal, then that's what leads to the procedure, which is a heart catheterization, where we can formally look at the blood vessels, and then if there's a blockage, fix the blockage by putting a stent in and opening up the blood vessel.
Sylvia asked another question. It may piggyback off of this one. How do we speak to our doctors about heart disease and get them to do good screening and not just say it's heartburn?
Yeah, no, that's a good question. You have to be your best advocate, but certainly for the heartburn part of it, if you are walking and you develop heartburn, or it's not related to food and you're feeling heartburn, or you've tried, Prilosec or Tums and it's not relieving it, tell your doctor all that information and say, hey, it might not be my, stomach. Could it be my heart? That's important. And then when you're speaking to your doctor about heart disease in general, tell them, you might be concerned. Say, hey, my father had a heart attack at 45. I have high blood pressure. I'm worried I might have heart disease. Can we do blood work to make sure everything looks okay? Or can we, do some sort of stress test to make sure everything's okay as well? If you voice your concerns, I'm sure most doctors will not ignore you, and they'll appreciate that you're knowledgeable about your symptoms, your family history, your medical problems, and they'll be happy to treat you and take care of you.
And I have one last question. How important is sleep deprivation and sleep apnea where this is concerned?
That's a great question. So sleep deprivation, sleep apnea, two different things, but both very important. So sleep deprivation, just lack of sleep, like you only are sleeping 4 hours a night, or like shift night work where you're working a lot of nights, maybe working back days, working nights again. There's a lot of evidence that can be harmful to cardiovascular health. It can lead to increased risk for high blood pressure, and it can also lead to increased risk for heart attack and stroke. So it's important to get sleep. It's important to get at least 7 hours of sleep a night. And it's important to get like uninterrupted sleep. We're all victim to this. This thing needs to be away from you. It needs to be across the room, because once you see the light flashing or you see the notification, it triggers, and then all of a sudden you're awake. Try to keep the room quiet and dark while you're falling asleep. Try not to fall asleep with the TV on. Try to read a book, things of that nature. And then the other part of it is sleep apnea. So sleep apnea is, for whatever reason, while you're sleeping, you stop breathing for 1 or 2 seconds. That leads to decreased change in the blood flow in your body, and can have impacts on both the brain and the heart, and can also lead to sleep deprivation in of itself. We also know that sleep apnea can lead to high blood pressure, heart disease, and then also heart arrhythmias like atrial fibrillation, which I'm sure you've heard commercials about. If you have sleep apnea, you're at an increased risk for atrial fibrillation as well. So if you've ever been told by your significant other that you snore, or you've ever woke up in the middle of the night like gasping for air, or if you wake up in the morning, you just don't feel, refreshed at all ever, you might have sleep apnea, and you may benefit from getting screened for it, because there's ways to treat it. Historically it's the big mask, but there's newer devices out there where it's smaller, or you can just go in the mouth or the nose, and it can help relieve the sleep apnea. The last part for sleep deprivation is it's also important to know that it's a cumulative. So, like, if you don't get good sleep for, first day, second day, third day, you can't just like sleep 8 hours the fourth day and think you're going to be completely re-energized. Your body needs to kind of recuperate a few more days before you're back to your baseline. So it's very important.
And it looks like we have one more question. It says, what exercises are considered safe for people with heart issues to keep blood flowing and the heart strong?
Yeah, no, that's these are great questions, really. Historically, like, many years ago, when patients had heart attacks, we would say, like, they would sit in a bed for 2 weeks, and then we would say, like, don't exercise at all. Now we know the opposite is better. If you have heart disease or you've had a heart attack before, being active improves your quality of life and your life in general long term. So I always tell my patients, again, aerobic exercise, whatever that is for you, and truly just not like push yourself like run a marathon, but exercise. Get your heart rate up, sweat a little bit and push yourself. And then if you get symptoms of fatigue or shortness of breath or chest pain, obviously stop, recover. And then the next day, try to push yourself a little bit further, being mindful of your symptoms. And every day, try to go further and further. And then you'd be surprised, after a couple of weeks, you're exercising more than you've ever done before. And that's going to improve your quality of life overall, and promote a healthy heart lifestyle as well. It's so important now that when a patient has a heart attack, across the board, 100% of them get referred to cardiac rehab. What's cardiac rehab? Think of it as like physical therapy for the heart. It's a organized 36 sessions where you go and you exercise with like a heart monitor on you, but it's all to get your exercise tolerance up. So when you're done with the cardiac rehab sessions, you can continue exercising at home, promoting a heart healthy lifestyle.
Okay. All right. Well, that was great. Thank you so much for all of that information. Okay. And so in closing, thank you, Dr. Case, all
My
that
pleasure.
insightful information and the presentation on heart health and best practices. And we hope that all of you found this presentation very helpful. And if you are not already, we'll begin to put some of these great tips into practice. Thank you again to our MedStar team for our collaboration on this important initiative, and to all of you for joining us. Our next presentation will be next month. It'll be Ask a Gastroenterologist. So get your questions ready. And this presentation, of course, is going to be recorded. It has been recorded, and it'll be available on both MedStar's and Arc of Knowledge's Facebook pages, YouTube. So thank you all, and please enjoy the rest of your evening.